we've learned a lot from our good friend Dr. Dennis Norem from Mercy Health, and he is joining us once again here on this Monday morning. Dr. Norem, good morning to you.
Good morning to you guys.
How's everything going with you this morning?
Going pretty well. Some nice summery days coming up right here.
Yeah, 90 degrees. That's going to get everybody's attention pretty quickly.
Before we get going here, I'll give you 100 guesses to what Dr. Norem did over the weekend. You're not going to get it.
I'm going to say, well, he wasn't part of the SpaceX thing. I watched that. I didn't see him. I don't know.
Wakeboarding over the weekend, right, Doc?
Right. I went down to West Rock, down at Levings Lake. It's a blast. They just got opened this weekend and tried out my new knees.
I was going to say, your new knee must be working out pretty well.
It's a little sore today, but that's a good thing.
That is a good thing. Yeah. So, all right, get out there and get a little exercise. If nothing else, helps clear the head a bit.
Absolutely.
Dr. Norm, I want to ask you about this one. World Health Organization, tail end of last week, came out with a recommendation that healthy people, including those who do not exhibit COVID-19 symptoms, only wear masks when taking care of someone infected with the contagion, a sharp contrast from the advice given by American public health officials who recommend that everyone wears one. I have a quote from Dr. April Baller, public health specialist for the World Health Organization. If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a mask. Masks should only be used by healthcare workers, caretakers, or by people who are sick with symptoms of fever and cough.
Well, I think it illustrates the issue that we've had all along with this COVID-19 virus is we just don't know for sure. And it seems like we shift back and forth. We started out saying we didn't need to wear masks. It didn't make any difference. And then we've all gone to thinking we all need masks. And now there's some evidence that maybe we don't all need masks. I think the jury's still out. I don't think we know yet what will be the most effective. I see that asymptomatic individuals can shed the virus for about 8 days. But again, we don't know if that shedding of that virus, how effective that is. So I think until we have a little more information, we're probably going to be recommending wearing masks.
So what evidence would this study have found to say that masks for people not showing symptoms isn't necessary?
I think it shows that the people who don't have symptoms but have the virus are going to be fine. Then the second part of that is how infective are they to other people, and does wearing a mask protect other people from you and or from the asymptomatic individual infecting them? And we just don't really know yet. It seems like maybe that doesn't happen. That's very rare.
So are you saying that because we've heard when we hear asymptomatic people, it in my head at least, it was always that person's a ticking time bomb. We're just waiting for the virus to infect you. Is there thought now that if you're asymptomatic, it just means you're never going to come down with COVID-19?
Well, I think it means that you've been exposed to the virus. Your immune system has processed the virus, and you're not going to get symptoms, and you're not even going to be aware that you've had the virus. But at some point down the road, if we test you, we're going to find out that you've responded to the virus, so you're never going to get sick. So you're not really a ticking time bomb. I think most people who are going to get sick fairly early on in the exposure.
Story goes on to point out the recommendation has not changed and differs from the CDC, which urges individuals to wear a mask or face covering in public settings, regardless of infection or not, to limit the spread. Quoting from the CDC guidance, we know now from recent studies that a significant portion of individuals with coronavirus lack symptoms, asymptomatic, and that even those who eventually develop symptoms, pre-symptomatic, can transmit the virus to others before showing symptoms. In light of the new evidence, CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. That's what you're talking about, where you're getting information from two generally credible organizations that people look at and go, oh, well, the World Health Organization says this. Well, that's in direct contrast to what the CDC says.
Well, absolutely. And again, it illustrates the issue that we just don't have all the information in on COVID-19. And this is typical of medicine in general. what we knew today that we think is true, we may find out tomorrow the opposite is true. And we're still on that learning curve.
How often do new diseases pop up? And are we learning about this coronavirus at the same pace that we do normal other diseases that maybe don't affect us on a global scale? Is this research, how ramped up has this research been?
Oh, this research is really ramped up. If we think about this, we didn't know anything about COVID-19, September, October, November. Mm-hmm. We heard some rumblings around the first of the year. We're only into the 1st of June, and look where we're at in terms of all the information that's coming in. Granted, some of it's conflicting, but that's to be expected. But we really are only dealing with a 6-month time span with a new disease. I think that's very impressive.
Looking at one of the countries that's been frequently discussed during all of this is Sweden, and how they've gone about how they've dealt with it as opposed to most of Europe, including their Scandinavian neighbors. Headline out this morning: Sweden's COVID death rate now 10 times higher than neighboring Norway. Now, this is on a per capita basis. According to World Odometer's website, 435 out of every 1 million Swedes have died from the virus, while the virus has killed 44 out of every 1 million Norwegians.
Yeah, I saw that article. It was very interesting because the health minister in Norway is saying maybe they were too aggressive, implying that, yes, their death rate is a tenth of their neighbor in Sweden, but the cost to the country in terms of their economy has been absolutely dramatic. So they're kind of thinking maybe they were overly aggressive. I think that's very helpful to us as we learn more about the COVID-19 virus, and as we open up this country to look at those issues and see where is the happy medium, if you will, what makes sense to do and what maybe is a little bit too aggressive.
Yeah, looking at some of these, the Swedish ambassador to the United States in April, about 30% of people in Stockholm have reached a level of immunity. We could reach herd immunity in the capital as early as next month, but a recent study found that just 7.3% of Stockholm residents tested positive for coronavirus antibodies at the end of April. Professor of infectious medicine at a university in Sweden says, I think herd immunity is a long way off, assuming we ever get there.
Yes, their idea, I think, at the beginning was, okay, we're going to kind of let things go. We'll have this herd immunity. But as we've discussed before, you probably need to get to 60 to 70% of the population before you're going to have significant herd immunity. And the only way you're going to do that is through a very effective vaccine. So I think that's a long ways off for Sweden. So it'll be interesting to kind of watch the contrast between those two countries.
The word that hasn't been popping up lately that I thought was going to be a lot more divisive and inflammatory, contact tracing. I haven't heard that being used as a solution recently. Have we lost that idea of doing contact tracing? And what do you know about how effective that's going to be if we do implement it?
Well, if we look at what I think South Korea has done, they have a very effective contact tracing program, which has helped them. I think the problem here in the United States is we don't have the infrastructure to really do that effectively. It absolutely could be very beneficial if we had enough people to do it. And I think the other part of it is if we have enough people in the United States that would cooperate. I mean, it's one thing to do contact tracing and call up somebody and say, you were in contact and you should quarantine yourself. But, given what we've seen with some of our American citizens, I'm not sure how many people are going to really follow that advice.
Did South Korea already have something in place?
I think they have a fairly good structured public health system there. And, culturally, they are, I think, people that are willing to do what is good for the community and the country. So I think they ramped up their contact tracing and have done a reasonably good job of doing that.
Good to know. A little different population, a little different dynamic involved in all that in trying to do it here. And I'm with you as far as, cooperation goes, as far as the public goes. If we got a 50-50 split, I think would be pretty good.
Yeah, I think that if 50% of the people followed the recommendations, I think that would be doing well in this country. So as we move along, we'll have to watch and see how other states, and I know some states are trying to ramp up some contact tracing, but it remains to be seen how well we can do that.
What are your thoughts on, because I see this being opined on a lot this morning, on the possibility of a rebound in COVID infections and or deaths following what we're seeing as far as riots and protesting going on across the country?
I think there's an article yesterday about hotspots. I think you may have seen that. There's several states, I think about 6 states, that have opened up, some a little early. Arkansas, Alabama, even California, North Carolina, and they're seeing a little bit of a rise in COVID deaths, which is not unexpected with the opening up the economy. And then you see how people open up and they have these parties. But when you get to the protesting, that's going to be very interesting to see if the protesting people are going to be able to pass along COVID. On the other hand, I think most of the protesters are wearing masks, so maybe there's one benefit there.
You mentioned earlier that there's been, we've heard, we went from masks to no masks. There's been a confusion of information going out, and that's, I'm sure you can attest to, is just how science works. I think a lot of times when the public asks the science community a question, the words "I don't know" isn't really acceptable. So we kind of force answers out of the community. How would you have changed the way the information is doled out to the public to avoid confusion like this in the future? Or is there just not a way to get this done smoothly?
It's difficult to do it smoothly. I think that what I would, ask the public to do is to try to stick to the credible sources, and hopefully our healthcare community, in terms of the agencies, the CDC, the National Institute of Health, the public health departments, hopefully they would coordinate their messages, which they've done a fairly good job, but as you've seen, there has been some conflicting information coming out. But I think part of our problem that we experienced early on was a lot of people had their own ideas and tried different things and tried different treatments and claimed that this worked and that worked, and it created a lot of conflicting information and messages earlier on. I think more recently we have a more consistent message in terms of what's being recommended to the public.
Dr. Norm, before we let you go, because we're up against the clock here, what haven't we hit you up on this morning or asked you about that you've been covering over the last week or so that people should know about?
Well, I think a lot of information on the vaccines. I think there's some good information that we may definitely have something in the next few months. And the other thing that popped up is there's a testing of antibodies. We all talked a little bit about the fact that they're taking plasma and giving the patients with the disease, and it seems to be very effective. There's a lot of work being done on being able to manufacture antibodies, which we already do for certain diseases, and that may be one of the breakthroughs that we yet haven't heard much about.
It would be excellent to hear the word breakthrough trumpeted across a few headlines for a few days, wouldn't it?
Yes. Something that actually was a breakthrough.
Yeah, something that actually was a breakthrough, not debunked 4 days after that. That's an excellent point. Dr. Norm, as always, we appreciate the time, we appreciate the expertise, and hopefully you'll be willing to join us once again next Monday to keep kicking this around.
Sounds good, guys. I'll see you then.